I'm Dan Cook, and welcome to another episode of Ortho Innovators, sponsored by Precision Medical Technologies. Today, I'm honored to be joined by Dr. Ryan Krupp, an orthopedic surgeon with Norton Orthopedic Institute and Executive Medical Director of Orthopedics and Sports Health and Shoulder Reconstruction for Norton Healthcare. He's also actively involved in designing innovative surgical solutions and enabling technologies. Welcome, Dr. Krupp. Thanks so much for joining me today.
Oh, my pleasure. Thanks for having me.
So, our company is based in the Cleveland area. So I have to start off by asking about your Ohio background and how you found your way to orthopedics.
Yeah, so grew up in northwest part of Ohio, very, blue collar, working class area. My dad worked in a factory for 30 plus years. And so I attribute a lot of my work ethic and the grind to kind of that background. I actually was, played football, baseball, and basketball in high school, and then had an open tibia fracture my sophomore year of high school playing basketball. And so that was my first kind of foray into orthopedics and the impact that you can have on someone's life. So that sparked my interest. I spent some time shadowed with some orthopods after that point. And so then, fast forward into med school or to undergrad in med school, it was always kind of a drive for me. Is like it just kept kind of pulling me back. And so I gave consideration to some other fields, but really orthopedics, it kind of fits me really well. It's you analyze things, you assess the problem, figure out a solution, and then take action. You can see tangible results. And it's mechanically based. I have a chemical engineering background, and so just all those pieces kind of fit together.
Yeah, tell me about that chemical engineering background. You graduated from the University of Dayton with that degree before going to the University of Louisville for medical school. You kind of alluded to it just then, but how does that inform you as an orthopedic surgeon now?
People are often asking me like, gosh, you could have done a lot of other majors and things that maybe a little easier, that kind of stuff. But, I wouldn't trade it. Really, it's the thought process of taking a problem, dissecting it, and then finding a solution. And so I use it all the time, both in my clinical practice, but also in the product development realm. Just having that background and being able to implement, across the board has been very helpful.
Great. You were one of the surgeon designers on the ROSA Shoulder Platform. How did you get involved in that project, and what excites you about your contributions to it?
Well, so it's interesting how things evolve kind of in development. And so I did a lot of work over the years with Zimmer Biomet, teaching and doing some work on product development. And, so they kind of tab people and say, hey, gosh, you have a certain skill set that might be applicable to this next project. And so it was just kind of a seamless transition given my background and kind of my interest and kind of pushing the envelope into the next, foray into where orthopedics are going in the future. And so, robotics is one tool that we're kind of assessing and trying to develop and see, gosh, how can this impact our regular daily practice? And there's a few ways that I think that it really can make a difference. And, one, the whole idea is to make sure that we're trying to eliminate the outliers, right? So we kind of keep things in the middle of the road. Number two is, we're doing more and more pre-operative planning in a virtual space. So we take a CT scan, we send it off. You can develop a 3D virtual model and really do a lot of the surgery and planning ahead of time, which is great. And it's amazing how much you learn through that process. But one of the challenges historically is like, well, how do I take that plan and make sure that I implement it exactly the same way in the surgery? We've used PSI or patient-specific instrumentation guides in the past, but you got to get those manufactured and sent in, and there's a lead time for those. It could be even up to 6 weeks. Sure. Well, with a robot, you can do the planning, and it's really a software input into the machine, and then you can implement it almost instantaneously and do it exactly the way you plan. So that's a kind of second attribute of this. And the third part is we collect this data. You've got surgeons that are doing high volume, you can collect this all, then you look at like AI going forward, maybe, and then you can analyze and say, hey, okay, here's a surgeon maybe does 10. Well, they can implement their CT scan in virtual modeling, run through the AI software and say, well, based on the surgeons that do, over 100, and there's 10 surgeons, this is where we would recommend you place this for the optimal outcomes. And so the opportunity from that perspective going forward is really exciting. So there's really several goals in mind when you're thinking about robotics, or even mixed reality is another avenue that we're looking at and developing, whether it's complementary between the two technologies or a standalone. Because one of the issues with the robotics is obviously you have this $1 million robot.
Sure.
So there's only going to be certain facilities, and from a size perspective and that kind of thing, that it's a little bit more limited. Whereas mixed reality, it's a software issue with a lot less hardware, and you might be able to implement that for the same goals, but across a larger array of locations and settings.
Sure.
So it's going to be an interesting thing to see how this all plays out, but it's exciting to see where things are heading, all in a goal of optimizing outcomes, reducing outliers, making sure that we're kind of staying in the center of the road, and being able to implement the plans that we develop ahead of time.
What were the unique challenges of helping to design a robot as opposed to perhaps an implant? That must have been exciting and kind of fun.
Yeah, it is exciting, and it definitely presents unique challenges for sure. There's a lot of different things. One is the whole software component, and so as you make iterations and assumptions and calculations, but the mechanical part of it, there's only so many degrees of freedom. And it's funny with the robot, it actually is like an arm, and so it has an elbow and a wrist, and the same kind of things we would have, but you get it in certain positions, and it doesn't like to go past those positions, and then it can present mechanical blockages, and it can disrupt the way the robot works. So getting it in the correct position, the patient in the correct position, and then making sure you put it in a position that it can deliver the positioning that we want is critically important. So that's one of the unique challenges. The other thing is trying to work around the normal setup of an operating room, the retractors, the assistants, and things of that nature. When you got this robot and the arm coming in and everything, and try to work together, so it's like having another person in there that you got to work around, which can also be a bit of a challenge.
Sure. And robotics have been used in spine, in the knees, in the hips. Can you talk about the growth of shoulder replacement and why that's an interesting area to focus? I think it's demand is exploding. And is that kind of the next big thing in joint replacement?
So I think it's a great point. It's one of the things that drew me to shoulders. It's a really complex joint. One of the crazy reasons you can do all the different degrees, your motion that you do, is the degrees of freedom. And so it presents its own challenges. So we're developing constantly and pushing into the next evolution of implants and techniques. And so one of the things we're looking at is stemless shoulder replacements. So we recently just launched here in the last couple of weeks, OsseoFit, which is a unique design stemless implant for the humeral side of a shoulder replacement. What makes it unique is that, oftentimes when you have stemless, they're very uniform, right? So it makes it easy to prep and to implement. The problem is you're not always optimizing the best bone.
Yeah.
And so we're putting the stemless implant in. We want to optimize the fixation, and ultimately try to be able to do not only anatomics, but reverse total shoulders using these stemless designs as well.
Sure.
So this is based on CT scan data, looking at a large number of specimens or patients, and trying to optimize exactly where the best location, the best fit. So the arms or the fins of this implant are different lengths. Some have T's on them. So it's designed to optimize, that each fin is in the best possible bone, that you've got great rotational stability, and you've got the maximum fixation you can possibly get. So they're right and left specific, which is unique. And like I said, based on that design, having, like I said, different lengths and optimum position for all the parts of the implant. So it's really cool. And it's also being able to be engineered so that we make sure that we're optimizing the overall bony on growth into the implant and through the fins, and then also optimizing the ability to, if you have to revise it later, you have ability to do that as well. So it's really a cool design, very unique. Really kind of the next generation of these types of implants, and really excited about the fixation strength. Really compares to some of the shorter stemmed implants that we have currently, which will allow us to take this to the next level.
Awesome. It's awesome. Another area of focus of yours is rotator cuff repair. And those can be extremely challenging, especially with the massive irreparable tears. Tell me about that clinical challenge and maybe some of the devices that help you perform more successful, longer lasting repairs.
So, rotator cuff tears, they run the gamut of size.
Hmm.
There's a lot of patient factors involved. What's the bone density? What's the tissue quality? Are they smokers? Are they diabetic? They have rheumatoid arthritis or other inflammatory conditions. So those all can impact the way you address the tear, the propensity for healing of the tear. And so we've worked and focused a lot on the mechanical integrity of the repairs, but we're now starting to look at, okay, what other factors are involved? Look at the biology of the repairs. So things like collagen scaffold grafts or things like different, platelet-rich plasma, that kind of stuff. So we've only scratched the surface. But even with all of those measures, there's some tears that just won't heal or are too large to actually directly repair the bone. And so that's where things like the in-space balloon come into play. And so the whole idea is there's those patients that come in and you have this large tear and you're like, gosh, I don't know how you're compensating, but you look better clinically than the MRI looks.
Hmm.
But they usually will complain of some pain and they'll have some dysfunction. And so the idea is, so how do we take that patient that's maybe compensating not quite that good, but they do compensate some, so they have some propensity to utilize the other muscles and tissues that they have remaining in the rotator cuff and surrounding tissue. And so that's where the in-space comes in. And the whole idea is to take the humeral head when you don't have an intact supraspinatus and oftentimes infraspinatus, the head wants to rise up. And so you put the in-space balloon in, and what it does is it cushions that head, brings it back down to a more center position on the glenoid, and provides that cushion in a recentered position to allow you to optimize the compensation and rehabilitation of the remaining soft tissue, rotator cuff tissue.
Okay.
And so it's a unique, novel device, been used in Europe, for quite a while. I was brought to the U.S. more recently, but it's been another tool in the armamentarium to treat these difficult conditions.
Sure.
Especially, for me, the patients that maybe don't have significant arthritis. The target patient for that type of a device is one that has a propensity to compensate, does not have significant arthritis, and is driven and focused and willing to put in the rehab to get a good outcome.
Great. And you kind of mentioned, you alluded to orthobiologics. Tell me about what role they can play. Can you expound on that a little bit of what role they can play in rotator cuff repair and what needs to be done to, advance those treatment options in orthopedics? You were scratching the surface, but there's so much potential there. Where are we and where can we go?
So orthobiologics, presents another part of this equation when we're trying to, consider rotator cuff repairs. So we focus on the mechanical integrity, making sure we're getting good secure fixation, we're getting good coverage of the footprint. We're optimizing the overall tension on the repair. But then it's like, okay, what happens with the biology? So obviously you want to, if you have a diabetic, you optimize their diabetes control. And if you have smokers, you want to try to, limit or eliminate completely smoking, because these are all things that can inhibit healing. But then there's the biology part that we can address as well. And so, we're often looking at like things like collagen scaffolds. And so those can be, basically offer a framework or a scaffolding that the body can use to try to enhance that soft tissue healing. Now, those can be things from like bovine. There's some synthetic ones now. And then the question is, do you put those on the surface, on the upper surface of the tissue? Do you put it in the interface between the tissue and bone? Are they attached to the anchors? So like we did some research on the Biomet, which was a novel scaffold that was interposed between the tissue and the bone attached to an anchor. So really doesn't change the way you do a repair, but it can enhance the healing, adding that scaffold nonetheless. And so basically you get this wicking from the bone and the marrow, and it kind of gets collected in there in that scaffold, and it's interposed right where the healing occurs. So there's a lot of these things that we're just now starting to work with. We know that there's some clinical studies in animal models, they definitely have an impact. But our challenge now is to say, okay, what is that impact? What is the cost of a failure? What is the cost of utilizing these devices to try to enhance healing? And in a world where we're all, trying to maximize the dollars spent on healthcare, is to prove that it makes an impact that is cost neutral or actually provides an outcome that's worth whatever the cost is. And that's kind of our challenge going forward.
Understood. Yeah. There's obviously a movement toward personalized surgery in orthopedics. Is there also a growing interest in just minimally invasive approaches, muscle sparing, tissue sparing, and how is that influencing the design of implants, instrumentation, even enabling technology? Can you talk about that?
So we're always trying to minimize the damage to the soft tissues, to the bone. And so, for instance, like we talked about the OsteoFit stemless device. So one of the drivers there is, it's more bone preserving. You're not having to remove as much bone. So from a pain perspective, initially, that's better. If you have to do revisions in the future, that's better. People are living longer and longer. Many times people are getting these implants even earlier. And so the more we can optimize those, and if the fixation is even better, the fact you could leave an implant in, even if you have to do revisions in the future. So these are all things we take into account. We're also, always trying to be protective of the soft tissues, maximize, healing of those soft tissues as best we can. Things like, even like robotics, one of the hopes long-term as we develop the, version 1.2, 1.3, 3.0, as we go forward, that we get more and more accurate and more confident in the ability to place implants where we want them, that hopefully we can work through smaller windows, even look at, some of the soft tissue preserving type techniques where you don't have to have as big of exposure. We're always looking at different like instruments and designs to try to optimize that as well. And so I think that'll continue to evolve as we move forward. The challenge always is, some things we can do that makes sense from a soft tissue and bony perspective, but then if you're at all giving up some of the benefit of making sure that the surgery is done exactly the way you want it to be, then it's counterproductive. So we're always trying to balance those things to make sure that as we're moving forward, we're truly moving in a positive direction and not taking one step forward to take two steps back, if that makes sense.
No, it totally does. And you have a great perspective on, that the importance of collaboration between surgeons and engineers and product designers. You kind of have your hands in both. Why is that so important now? As surgeries are becoming more complex. That surgeons are trying to treat conditions in, as you said, a more minimally invasive way. Just talk about that important collaboration between surgeons and device designers, and what can be done to further that communication.
I think it's critically important for the engineers and the surgeons to work together because we all bring unique skill sets to the table. So, from a surgeon perspective, we're bringing, clinical acumen. That, there's certain things that are great ideas, but then you're like, gosh, once we get it into a patient, a clinical setting, there's no way that's going to work, or it's going to be cost prohibitive, things of that nature. The reverse of that is things, like understanding, the different nuances of like metallurgy and design and manufacturing. Once again, you can have a great idea, but if you can't manufacture it on a larger scale, then it's probably not worth a whole lot. And so too many times I think people work in silos and you don't get the benefit of the collaboration. It's the old picture with the two bridges being built from different sides of the river, and they get to the middle and they don't match up, right? That's what we want to try to avoid. I take this all the way back when I worked as a chemical engineer in a plant. The first thing I did when I had a project was go out and talk to the guys on the line and ask them, like, hey, what do you think about this? We're considering this change, whatever. And, sometimes you'd get in this nod of the head and like, oh, yeah, we tried that once. This will be a disaster. This will happen. But if you don't talk about it ahead of time and get all the parties that have a vested interest involved, you can often miss those little key facts, which can be little things in the front end and major problems later. So I think it's critically important that there's this collaboration and discussion And we all bring our tools to the table.
Love it. As innovations keep coming to market and orthopedic companies kind of look for the next big thing, why is it important to focus on solutions, with clinical data backing it, that, you can prove the value in it there's so much out there. How do you focus on the innovations that could really make a difference?
Yeah, so it's a challenge for sure. Trying to say, okay, which as we get more and more technology,
Yeah.
as we design more and more implants and instruments and things of that nature, trying to decide, okay, which ones truly make a clinical difference. Sometimes they're theoretical, but until you can see it clinically and be proven clinically and be cost effective, then that's really where the target or the bullseye is, if you will.
Mm-hmm.
So I do clinical research, and I think it's important for us always to be looking introspectively at what we do to say, gosh, when I make these decisions, is that making a difference in my patient's, outcome? Because ultimately, as we all basically try to pull on that healthcare dollar, we want to make sure that the things we're doing are impactful, truly delivering the outcome that we had as a target when we began the process. And so I think that, that gets harder and harder. We've got a lot more data, which is good, but then that's its own challenge when you try to decipher data, right? You got to say, okay, which facts are important, which ones are clinically relevant, and then try to apply that the best we can to make decisions going forward, to provide the best outcome and options for our patients.
Yeah, understood. There is so much excitement going on. Just as a surgeon, someone who's involved in product design and industry, look ahead 5 years. What just excites you about what's coming down the pike? What gets you fired up in the morning, or what are you looking forward to doing?
Yeah, I agree with you that it is an exciting time in orthopedics, particularly in shoulder, which isn't my area. I think that I think the project, the OsteoFit project that I'm on, seeing that evolve and grow in utilization, hopefully getting a reverse indication to go along with the anatomic indication as we go forward, because I think the fixation is extremely good with a novel concept for a way to achieve fixation. And it truly is an anatomy-driven design, optimizing the location and the implant positioning and the overall fixation. So you combine that type of design of an implant, and now you combine you take that design of an implant, and now you combine that or marry that with technology, so that you can, like I said, plan everything virtually ahead of time to optimize positioning. But then we have the data to know, okay, this is exactly where the implants were positioned. We delivered that, whether it be with mixed reality or robotics. So we know everything is exactly how we planned. Now we can collect data on the outcomes. We're now have the ability to analyze that data, whether it be for artificial intelligence or some other type of analysis software. We can then look back and say, hey, how do we optimize for this next patient? And so now the knowledge is power, right? Sure. And so that's really I think the exciting part as we go forward is we're going to have the tools to really, truly look at what we're doing and say, is this the best outcome? Can we improve upon that, whether it be positioning, whether it be implementation, whatever that might be. And so I think that really going forward over the next 5 to 10 years will be an exciting evolution in orthopedics.
Great. Well, thank you, Dr. Krupp. I really appreciate the time. It was awesome talking to you, and I appreciate the insights you provided.
Excellent. Thank you. I enjoyed it.